From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about minimally invasive spine surgery and new advancements to spine surgery. Our guest today is Dr. Sasha Vaziri, a neurosurgeon trained in minimally invasive and complex spine surgery. Dr. Vaziri, thank you so much for joining us today.
Thanks for having me.
Spine surgery, the words themselves sound very invasive. So what are we talking about when we discuss minimally invasive spine surgery?
So, I think it's, kind of counterintuitive. I think a lot of patients think minimally invasive spine surgery means that it's not going to hurt, that it's a magic wand. And the truth of the matter is all those words mean is that we're sparing muscle. So your recovery is quicker when you have a minimally invasive procedure done. You're able to walk further distances a lot quicker, and your pain scores go down after surgery a lot quicker. And so the way we do this is we avoid the muscular planes and we go in between the muscles. And so, or we disrupt very little muscle. And so we can do these multiple different ways. Oftentimes it's through small incisions, small tubes, and, with cameras.
These techniques aren't available to everyone. That meaning if you need spine surgery, you might not be able to have minimally invasive technique. So what patients are typically treated with the more minimally invasive techniques?
So, it used to be maybe 10 years ago, 15 years ago, it was a small subset of patients that were getting minimally invasive spine surgery. Now it's, while everybody's not a candidate for it, it really depends on their pathology. We're able to do a lot of the minimally invasive techniques on the broader population. So but it's not always right for everybody because sometimes minimally invasive takes longer. And sometimes we have to consider time under anesthesia and patient's age and their comorbidities. So sometimes the standard approach is the best way for a patient or a more conventional approach. So I think the key is try to have different skill sets and tools and apply it to the patient, so in a way that benefits them the best.
What diagnoses or what does diagnosis look like where a patient would come to see you for these issues?
It could be as simple as a disc herniation. It could be, they could have a slip in their spine that causes back pain. It could also be, deformity. Sometimes we do deformity surgery with minimally invasive approaches or staged approach combined with minimally invasive and a more open approach. So it really depends, but it could be run-of-the-mill disc herniations with sciatica, or it could be, significant back pain or deformity type pain.
And what's the process for diagnosing these patients? Where would they go first to ultimately come to see you?
I think often if they start having a problem, they see their primary care doctor, and their primary care doctor orders a series of tests. Often that involves at least an MRI for us to see the nerves. A CT scan and X-ray is usually not sufficient. It gives us valuable information, and we like to have it, but oftentimes for sciatica or for nerve compression or lumbar stenosis, for instance, these are things we see for minimally invasive spine surgery. We require an MRI to see how it's compressing the nerves because MRI is like an HD TV, whereas a CAT scan is more like a black and white television.
What are the benefits of using minimally invasive techniques aside from muscle sparing, like you said?
Well, I think the patients get out of the hospital quicker. They're in the hospital less time. They're off narcotics quicker. Narcotics now, where everyone's trying to avoid for various reasons. And so we're able to get them off pain medications a lot quicker. And they're able to get back to life, get back to golf, get back to pickleball a lot quicker than they otherwise would. It still takes some time. You have to heal after surgery, and it depends on the surgery that you had, but you're able to get to activities a lot quicker.
You mentioned time under anesthesia, but are there any other additional safety risks?
With minimally invasive?
Yes.
Well, it depends. Sometimes minimally invasive can be quicker than a standard open approach. It depends on the case-by-case basis. In general, kind of the trade-off is, with minimally invasive, we're seeing less, so we're able to do less. Whereas a more conventional approach, we're able to see more and do more. So it really depends, but overall, it has a similar safety profile as conventional surgery, and in some ways, it's actually safer in that there's less blood loss. and there is lower risk of infection.
So what does recovery actually look like for these patients who have a minimally invasive procedure?
Well, it's very variable and patient dependent. So a lot of times it depends on where you started. So if if you're starting in a very debilitated state, you're barely able to walk, you get to that point, sometimes it takes you a little bit longer to get there. So really what happens is the first week or so, I always tell my patients, it's like you have the flu, it takes a little bit to recover, and then after that, they kind of increase their activity. And so I tell them they can walk as far as they can tolerate after surgery. We actually want them to walk, but I don't have them bend, lift, or twist for about 6 weeks because we want everything to heal.
What advancements have you seen in the last decade in the world of spine procedures and specifically minimally invasive techniques?
I think there's been a few really exciting procedures that have come out. So we've had robotics, which helps us place instrumentation more accurately in the body, and navigation, which basically means we're able to do a CT scan in the operating room, and with some responders, we're able to actually see the patient's anatomy in the operating room and hook it up to a CAT scan and kind of almost have three-dimensional overlay, which is very nice. In addition to that, when minimally invasive technique, they started using small tubes back in the 1990s, and this has progressed. Now we're able to do surgery endoscopically through a tiny camera and a 10 millimeter incision for certain diagnoses. And we recently acquired the Teligent System, which is a hybrid approach, which is takes a camera that allows us to see more, but we are able to do it through a small tube, which is 15 millimeter incision, and so we're able to. It's kind of almost the best of both worlds.
We'll get to Teligent in just a second, but there are some other tools that have come to Sarasota Memorial that I know you and many of your colleagues are using quite often. How has that improved your patient outcomes, and what are some of your maybe go-to tools you're using with patients?
So I use robotics quite frequently, and so robotics is quite nice in that I'm able to plan the surgery often ahead of time, and so we're able to plan where the screws go when we're doing a deformity correction, see the degree of deformity correction we're going to get. So I've used robotics. I'm using patient-specific implants, meaning these are 3D printed implants that are specific to the patient's anatomy. And we're actually able to see, what type of correction we're going to get for deformity surgery, or even non-deformity surgery for if they have a slip or if they need a fusion. In addition to that, we're using endoscopic surgery, which is surgery through a small 10 millimeter incision. We're able to actually do fusions through a small 10 millimeter incision, which is great. And I came from a place where we actually did surgery that when patients were awake, similar to a colonoscopy. And so we would do spine surgery in that way. We're not there quite there yet at Sarasota, but I hope to get there where we could do surgery without the risks of anesthesia.
Endoscopic spine surgery, what are the benefits of that, and why is that so important for patients, aside from the obvious of such a small incision?
Yeah, no, that's great. So it's essentially, the way the surgery happens, it's through a small incision. Patients are able to go home the same day. They're able to go home the same day. And actually, my worry with endoscopic spine surgery is when we have a successful result, is that they kind of overdo it. So it's truly a muscle sparing approach. And so they have some pain in their back at the incision site, but it's not very bad. It's almost, equivocal to a injection, like a steroid injection that patients would get. And so the benefit is that I'm able to do things endoscopically that would sometimes require fusions. And so I'm able to spare a patient a larger operation because the angle that we're able to take to the spinal canal is such so that we don't have to do a fusion operation to get to the disc herniation that might be causing the patient's pain.
So you mentioned the Teligent System. What exactly is that?
So the Teligent System, you could think of it as, when minimally invasive spine surgery first started, we were doing surgery through a tube with a microscope. We'd take a large microscope, we'd bring it into the room, and we would look down the tube, and we would be able to do a discectomy or a fusion, and it'd be through a 20 millimeter port, almost about an inch long. So the problem with the microscope is that sometimes you can't really see the instrument. So what they've done is they've taken the tube, and they've put a camera in there like an endoscopic camera. Okay, so a camera that goes down there, and so you're actually able to see everything around that you weren't able to see within the tube before with the microscope. So the field of view is really enhanced. So as a surgeon, you're able to see more, so you're able to do a lot more. And so I think it's led to some really nice patient outcomes.
What patients is the Teligent system?
So I've used the Teligent system for decompressions for lumbar stenosis. Lumbar stenosis is when, because of the ligaments, they grow, they tighten the nerves, and when patients walk, their legs hurt. When they sit down, it gets better. Oftentimes, when they go to Publix, to the patient that grabs a shopping cart and they hunch over it because it opens up the spine and allows them to walk longer distances. So we use it for lumbar stenosis. We've used it for fusions. We've done fusions through the Teligent system, which is a very nice, minimally invasive approach. And in addition to that, we've used it for foraminotomies or discectomies where we've removed the disc. And those are really the pathologies. Oh, and I use it for synovial cyst, actually. So a cyst that a patient had that was compressing the nerve root, we use it to remove the cyst.
So I recognize that it's not technically an endoscopic procedure, but when you and I have spoken, it's kind of the fusion of minimally invasive and endoscopic. So what exactly does that mean?
It's like a hybrid approach. So, when we think of minimally invasive, a lot of what we're doing is through small tubes. So, the small classic 1-inch incision or 1/2-inch incision. Well, this takes that and it combines it with the endoscopic camera. So we're using a tube and then we are using the endoscopic camera, and we're able, in addition to that, when we traditionally do endoscopic surgery, I have one hand that's holding the camera and the other hand that's actually doing the surgery. Now I have the tube that's holding the camera, so I have two hands free. So I have much more range of motion, I have much more freedom, and I'm able to, and the other thing about the Teligent system is the way the camera's set up, it pushes you about 20 degrees, so you're able to see more in different directions.
With all of these new techniques, including Teligent and some of the others you've mentioned, what are the benefits you've seen as a surgeon and to your patients?
I think I think spine surgeons in general, everyone's afraid of us. We're like dentists, Nobody really wants to be at the spine surgeon's office. You only see us when you have pain. But what it does is it allows us to give the patients a lot of different options. And it allows us to tell them, these are there's always a trade-off, unfortunately. So, if we do something conventional and open, there's usually a slightly higher chance of success, versus minimally invasive, the less we see, so we are able to have a frank discussion about, the pros and cons and allow them to pick which approach they'd like us to take. And so it really allows for a patient-centered approach, and it really allows us to put the ball in their court and say, these are the different ways we can do the surgery. These are the pros and cons of each approach. We can try a very, very small surgery, but the chances of success are smaller than the bigger surgery, and so which one would you like us to try? And so we have this frank discussion, and oftentimes when I see patients in clinic, I see them about 2 or 3 times before we decide to have surgery. And so we're able to have this we're able to build a relationship and talk about the best ways of fixing their pain.
What's your message to the community about spine surgery? I know when you and I have spoken, there are a lot of misconceptions.
I think the important thing is, one thing patients need to understand is, aside from surgery that we do for tumors or spinal cord compression, in the neck and things like that, a lot of the surgery that we do is for pain, okay? And so if it's surgery for pain, pain is a quality of life procedure. So I, as a surgeon, never tell patients that they need surgery for pain. They tell me when it's time. So I think there's a misconception in that, patients, when they come see us, sometimes they expect surgery or they expect us to tell them that they need surgery. But I think a lot of times if we're practicing in a very patient-centered approach, we really depend on the patient to tell us, when it's time and whether or not they need surgery. And oftentimes, if you have the right patient, they've tried everything other than surgery and it hasn't worked. And they've failed injections, physical therapy, all those things. Oftentimes we help and we can get a really good result.
And with some of these more minimally invasive and endoscopic techniques, have you seen better patient outcomes?
Absolutely. I've seen patients who've, every procedure that we've done with Teligent has been a complete success so far. And so we've started the process, here. We got it in October, and so we've done several procedures with Teligent now, and they've all the patients have been very happy with the results. And what I've seen with the minimally invasive procedures is that we're able to get good results, and the patients are able to go home quicker. And oftentimes my worry is that they're doing too well, and they start to overdo it before I'm ready for them to.
So I know we've talked about a lot of different kinds of procedures today: robotics, endoscopic, minimally invasive, and there's so much more we could dig into with each of these procedures. But is there anything else you want to make sure that patients are aware of or patients know about spine surgery?
Yeah, I think there's been a technological kind of boom or expansion within the field of spine surgery that's made the results safer. It's made the results more reproducible, and patients have better outcomes. And so I think as a whole, I think the field's been progressing in a very positive direction.
All right, Dr. Vaziri, thank you so much for joining us today to answer all these questions. As always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.